the problem we have, period, in our healthcare system is you don't, even if you're on commercial, one of the reasons that costs keep going up is it's the one thing in life that nobody pays for. I mean, how many people have gone to the doctor and they say, okay, I'm going to run such test, and you've gone, hold on a minute, how much is that going to be? And because the whole system's set up that way, nobody asks that question. Well, in most of our healthcare plans, at least there's a deductible or a copay or something that makes you think, where am I? I'm going to make some sort of rational cost-based choice here. But in a system where something is totally free and you can't deny care for any reason, how does that ever happen? And so if that doesn't ever happen, then how do we ever control the cost of it and keep it from being 50% of our state's budget? So what we're asking for is just a minimal ways that we can help begin that process. And if I've sat down across from President Obama with Valerie Jarrett, with all of his top people, and they all say, we agree with you, we agree with you. Now go see what you can work out with HHS. And you go there, and they're not intentionally being ornery, but then we get kind of stuck in the, well, you can't do this, you can't do that, you can't do that. At the end of the day, I don't have anything that I can bring back to Nashville and sit down with a highly doubting legislature that says, okay, we will do that. So I have a financial issue, I have a philosophical issue, and the last one, just to be blunt, is a political issue. It's not like we're close in Nashville to getting something passed. Last year when we were working on doing something, the strong message I got back from the legislature was, don't bring us anything that looks at all like traditional Medicaid expansion. And people have said, well, why don't you make them vote? Go put them on, you're the one being burned all the time, go put them on. Well, oh, that's great, and that might be nice for me politically, but that doesn't get us any closer to the goal. So all you have is a lot of people going, all right, no. But that doesn't help me solve the problem. And if you really want to solve believe me, the easiest thing for me to do politically would be, the first easiest would be to say, forget it, we're not doing it, the legislature won't do it, we can't get it done, and then, decided. Second easiest would be to say, go make the legislature vote. Well, I can tell you how they vote. They vote no, okay, and probably not close. But neither of those gets us to any better answer toward doing what I'd love to do, which is cover more people in a way that the state can afford. And I honestly think there's a way to do that. Now, can we get it done or not? I don't know. I honestly don't. But if I didn't think it was worth it, I promise you I'd have thrown in the towel forever ago, because it'd been way easier on me politically.